Hi, I'm Dr. Mugdha. I work as an obstetrician and gynecologist in Pace Hospital, High-Tech City, Hyderabad. So it's a spectrum of infection and inflammation of the pelvic genital organs, specifically involving uterus, that is endometrium of the uterus, tubes, ovaries, pelvic peritoneum, and all the structures surrounding it. So, the cervix, which is located inside the vagina, it ascends the infection from the vagina, carrying it upwards and affecting any organs which is surrounding it. So people with multiple sexual partners or early teenage girls, menstruating teenage girls, because in these women, there will not be a proper defense mechanism to prevent the infection, or people with copper T or Mirena, IUCD is inserted, or sometimes partners having some urethritis or some infections or some sexually transmitted infections. These people are at more risk of having pelvic inflammatory disease, or sometimes even immunocompromised people will also have risk of getting these infections. Dull aching abdominal pain which is not associated with any other complaints, or maybe sometimes fever or just generalized weakness, some menstrual irregularities like heavy bleeding or foul bleeding, or sometimes even excessive multiple periods in a month, or sometimes even purulent white discharge which is very heavy and foul in smell, or even the most important symptoms is dyspareunia, which is painful sex, or pain after intercourse, or irritation and itching during intercourse, and all these things. These are the symptoms of PID. So we go through a multiple series of examination which includes blood examination, then physical examination of the cervix, and taking a swab and sending it to culture, and even doing a pap smear, blood test which includes STDs examination and any risk factors present, any immunocompromised patient examination, even doing an ultrasound which will show signs of inflammations, free fluid in the abdomen, or cervicitis, endometritis. These are some of the mentions in the scan which can be suggesting to PIDs. And the definitive is definitely doing a diagnostic laparoscopy which will show some signs of inflammation like red string-like appearance, string-like adhesions, which are clearly indications of PID. So treatment is definitely depends on the severity of the infection. Our goals majorly is to prevent future infertility and also its recurrence. So we can treat it on the outpatient basis by giving some analgesics and some antibiotics, and also some pre-probiotics, on which basis some good bacteria can come up and heal you internally. But if the patient is not responding for more than 48 hours, or if the symptoms have not come down in that 48 to 72 hours, it is always advisable to go for inpatient admission and treating you accordingly. Inpatient, we give IV antibiotics, and also we give supportive care, like we treat for any dehydration if present, or any painkillers, and according to the culture report, antibiotics are also started. Definitely IV antibiotics are more potent to treat pelvic inflammatory disease. So and in some cases where an abscess is present, or some pyosulfings or hydrosulfings, or some cases which are not responding to even IV drugs, in that case laparoscopy is suggested for the removal of the abscess or removal of the tubes. If any problem in the tubes and all, it is suggested. So complications can be immediate as well as late complications, late sequel. Immediate complications is basically peritonitis, which can be generalized, or pelvic peritonitis, and then septicemias involving myocarditis, arthritis. This can be the immediate effect of or acute PIDs. Then what are the complications late which occurs is basically revolving around infertility, which can be due to the blockage of tubes, or sometimes ectopic pregnancy, in which also the tubes is only the main important reason because of which you can have ectopic pregnancy. and sometimes forming an abscess, or sometimes dyspareunia is very important reason, and sometimes adhesion formations and resulting into hydrosalpinx, pyosalpinx can be the late sequel of the disease. So prevention can be generalized prevention, like taking proper diet, proper hygiene practice, and some basic preventions like definitely using a barrier method of contraceptive like condoms, or even using oral contraceptive can be a method of prevention, and avoiding multiple sexual partners, even partner evaluation for any STDs or any infections. Then taking vaccines like HPV vaccines can also be very helpful in preventing PID. Yes, the acute symptoms can definitely be cured. We might be able to cure some specifically presenting symptoms, but sometimes due to the spoilage of tubes, we might not be able to prevent some complications like ectopic pregnancies and all in future. But definitely at least we can make a patient understand the severity of the problem, and therefore we can make them aware of something called ectopic pregnancy or infertility, and tell them to be very cautious whenever they miss their period and all. It depends on what is the age of the child. It is not only that sexually active women will be having pelvic inflammatory disease. As I already told you, teenagers with menstruation can be infected. So definitely, because they don't have very good defense mechanism developed, so they can be infected. It depends on the age of the child. Yes, actually pelvic inflammatory disease is very important reason of infertility. Sometimes blockage of tubes or even any infection in the tubes is the reason of people having infertility. You cannot say vaginitis is the cause. Vaginitis is a milder form of pelvic inflammatory disease. In PID, what we generally say is if it is infecting the vagina, we call it vaginitis. If it is infecting the endometrium, we call it endometritis. If it is infecting the tubes, we call it selphingitis. And accordingly, we name it as PID.